Pharmacy Fraud by Angelica Brannon. The retail value of prescription drugs filled annually in the United States exceeds $300 billion per year. A large percentage of those prescriptions are paid by government-sponsored health insurance plans such as TRICARE, Medicaid, Federal Employees Health Benefit Programs, and Medicare. The massive scope of the prescription drug industry makes it a lot easier for pharmacies to engage in aberrant behavior. The top 5 most egregious pharmacy fraud schemes involved include dispensing less than the prescribed quantity of a drug, billing for a brand name drug when a generic drug was dispensed, billing multiple insurance payers for the same prescription, billing for false prescriptions, and substituting a more expensive drug for a cheaper one. Consumers are unaware that many of the pharmacies engaging in fraudulent activity are known as trusted retailers. Retail giants such as CVS Pharmacies and Walgreens face a class action lawsuits by its employees. Pharmacists noted that these pharmacies billed multiple insurance payers for the same prescription and inflated the costs billed to government-sponsored health insurance plans. On April 15, 2011, CVS Pharmacy Inc. agreed to pay $17.5 million to resolve false prescription billing. The allegations were brought to the government by Stephanie LaFleur, a CVS pharmacist in St. Paul, Minnesota. Ms. LaFleur noted that CVS submitted inflated prescription charges to multiple state Medicaid programs. CVS billed for more than what was owed for these prescription drugs dispensed to Medicaid beneficiaries who were also eligible for benefits under a primary third-party insurance plan. In addition, CVS billed and was compensated a higher amount by Medicaid than any other insurance payer. The same billing practice was also seen by pharmacists Neil Thompson and Dan Behrens in Minnesota. These pharmacists claimed in their federal and state lawsuits that Walgreens started a billing system designed to cheat Medicaid prescription charges. The system was designed to only bill customers who also maintained their private insurance. According to the pharmacists, Walgreens should have only billed the Medicaid program customers the same limited copay on prescriptions that it would have normally billed the customers' private insurance plans. Ultimately, Walgreens agreed to pay $9.9 million to settle the whistleblower lawsuit. Generally, smaller retailers, aka mom-and-pop pharmacies, are trusted even more by consumers than their larger counterparts. Consumers don't expect their local longtime pharmacies to dispense less than the prescribed amount, bill for a brand name drug when a generic drug was dispensed, or substitute a more expensive drug for a cheaper one. However, these smaller scale pharmacies find it hard to compete against chain pharmacies and turn to fraud to stay afloat. On February 25, 2015, Kanawha City, West Virginia's Trevelyan's Pharmacy pled guilty to dispensing less expensive compounded drugs while billing for more expensive brand name drugs, dispensing generic drugs while billing for more expensive brand name drugs, billing for drugs that were never dispensed or were expired, and dispensing drugs that were compounded outside of a safe and clean environment. The pharmacy even went on to admit that they had dispensed compounded drugs under labels and numbers associated with brand name drugs. Compounding drugs is regarded as the process of mixing, combining, or altering drugs in the exact strength and dosage required by the patient. If a compounded drug's strength, dosage, or drug is incorrect, it can cause the patient harm and up to death. The fact Trevelyan's passed their compounded concoctions as brand name drugs and prepared them outside a safe and clean environment shows that they had no regard for their customers' well-being. The drugs dispensed could have been easily cross-contaminated. The pharmacy openly admitted to committing other egregious crimes, but putting patients at risk by far is the worst type of crime any entity can commit. The rise in storefront pharmacies with no real employees, no real patients, and no real prescriptions has become an epidemic. The Office of Inspector General for the U.S. Department of Health and Human Services has been able to prosecute and shut down many of the phantom pharmacies with the assistance of local law enforcement. LBS Pharmacy was the most egregious case worked by the OIG and local law enforcement. The case was prompted by a tipster who contacted Special Agent Brian Hill. Hill followed up on the tip and for an entire day he and his partner sat staring at LBS Pharmacy's building, but noticed that no one went in or out of the building. At the same time, the OIG was monitoring the pharmacy's online billing activity and noted that the pharmacy had billed Medicare around $100,000 for high-priced prescription drugs. On the second day of the stakeout, Hill caught a break when he saw a man entering the pharmacy and decided to confront him. The man stated that he was hired by the owner of the pharmacy to pick up a UPS package for $50. Throughout the course of the conversation, Hill asked the courier if he could take a look around the pharmacy, and the courier agreed. Once inside the building, Hill quickly realized that there was no inventory, pharmacists, or customers. The walls were completely bare. An hour and a half later, he was issued a warrant by H. Ron Davidson, a prosecutor with the U.S. Attorney's Office. Warrant in hand, the agents returned to LBS Pharmacy to conduct a search, but there was nothing to find. 2 days after the stakeout and only 9 days in business, the pharmacy billed Medicare $776,298. But thanks to his gut instinct, the pharmacy received only $70 in payments. Medicaid covers the poorest, most vulnerable people in American society. Overcharging this needed government program for prescriptions is a disservice to everyone. The impact of fraud schemes mentioned above, as well as all medical fraud, is one of the unfortunate reasons why insurance premiums go up each year. For more information on this topic, please reference the following sources.